is serotonin syndrome different to neuroleptic malignant syndrome? Part of the psychiatry series. So both of these can be triggered by drugs, and both of these present with an altered mental status and a life-threatening serious condition that the patient is launched into. Neuroleptic malignant syndrome is caused by neuroleptics or antipsychotics, which are treatment of schizophrenia and psychotic disorders. Serotonin syndrome is an altered mental status because of SSRIs, which are in combination with another antidepressant, which has led to an overaccumulation of serotonin in the brain. Too high serotonin is going to launch you into serotonin syndrome, which is going to be called you can remember it's hypothermia, hyperreflexia, and hypertension. Now, the interesting thing is you may not be able to distinguish these two based on the vital signs alone, because you're going to see a high blood pressure and tachycardia in both. Okay, and the sympathetic nervous system is going to be in overdrive. The autonomic signs will be there in both conditions. But in neuroleptic malignant syndrome, they're going to have a history of an antipsychotic use, which occurs due to the neuroleptic blockade, antipsychotic blocking the dopamine 2 receptor. And this takes a longer time. It takes up to 3 days. Serotonin syndrome, this occurs to using something like an SSRI, selective serotonin reuptake inhibitor. And remember, when it inhibits the reabsorption of serotonin, you are left with a lot more serotonin in that intersynaptic space, synaptic junction, to then lead to accumulation of serotonin, leading to a buildup of serotonin. And especially if you're using the SSRI with combination of MAO inhibitors. And MAO, once again, is that catabolism thing. It's the Pac-Man that MAO, think of it as the Pac-Man that eats the catecholamines. Now, if you inhibit the Pac-Man, it's not going to be eating the catecholamines, which is again leading to a buildup. Serotonin syndrome is shorter, S for short lasting, less than 24 hours. NMS can take up to 3 days. Now, the vital signs we've said are the same or similar in both, with hypertension, tachycardia, and a high sympathetic nervous system, and you might get different signs there, but it's more or less the same. You have to look at the muscles. What are they doing? What are they doing? In neuroleptic malignant syndrome, imagine a man with tense muscles, super stiff muscles, muscle rigidity, lead pipe man with lead pipe muscle rigidity, super stiff muscles. They're presenting with super stiffness. And remember, both have, I should have written here, altered mental status here. They both have an acutely unstable, altered mental status patient with tachycardia, hypertension, SNS overdrive. But this one's going to be super stiff with muscle rigidity, lead pipe rigidity, and low reflexes, or hyporeflexia. Serotonin syndrome, however, is a neuromuscular disorder. Sorry, I shouldn't call it just a neuromuscular disorder. It's a neuromuscular symptoms that are occurring. So they have involuntary muscle contraction. They have clonus, which is contracted muscles, repeat contraction, twitching of the muscles, and heightened reflexes, or hyperreflexia. Here I should have just put hyperreflexia so you can compare. And that is it for serotonin syndrome versus neuroleptic.